where the Gauteng Health Department says it's looking forward to accommodating newborns needing special care at the expanded neonatal intensive care unit of the Chris Hani Baragwanath Academic Hospital. The department is set to outline the numbers of babies born on New Year's Day. Now, joining us is Katleho Sekhotho, who is out in Soweto and has more details. Katleho, Happy New Year to you. I see you spending the morning with New Year's babies that have been born at Chris Hani Baragwanath. And we also heard the MEC just speaking there about the e-health system and how it's assisted with the statistics of knowing the children who are born in the hospital in terms of what nationality they are.
Absolutely. A very good morning, Katleho. A happy new year to you as well. Certainly a happy moment for many mothers here at the Chris Hani Baragwanath Hospital as they cradle their bundles of joy in their arms. And it is about celebrating babies born on this significant day, the first day of 2025. And certainly the health department looking at the expansion of that neonatal intensive care unit, being one to accommodate especially, children that need specialized care after birth, and the department making that commitment that it will not just happen here at the Chris Hani Hospital, but at the other hospitals throughout the province. But to get more details about some of those stats, I'm joined by MEC in Health. MEC, thank you so much for your time. Can you just remind us of how many children, babies were born here at the hospital, and also when we can expect the overall picture from a provincial perspective?
We managed to go to 13 kids in our hospital only now, but the others are still coming, including other hospitals, but I'm sure in the afternoon we'll give you the right numbers. But here we have 13 and we have 9 boys and 4 girls that we've received. And I complained that at least I thought it will be 9 girls and 5 boys, 4 boys. Unfortunately, it didn't happen that way. But we're excited indeed because we've even renovated a ward. Because now my strategy is every December, I must not just come and give mothers their little presents for their bundles of joy, but I must make sure that I renovate some wards, neonatal wards. In all the hospitals, we have an aggressive campaign now of renovating neonatal wards. You have seen even in Tembisa, we have done that last week. We are opening a new ward here at Bara that you are going to see immediately after this interview, but even including other hospitals. We don't want our staff members to suffer because of the environment where they are working. But again, our patients to have a problem in terms of where they give birth, their bundles of joy. But we're working again with Home Affairs. You have seen us distributing even the birth certificates in the mothers that have already received them, including the road to health. But again, I was doing education awareness, telling the mothers the importance of breastfeeding their children, which is an exciting thing again because your child gets more developed faster when you are breastfeeding. And again, there's that close relationship and the bond that you get when you are breastfeeding your child.
Absolutely. And another question, MEC, you mentioned that out of the babies born, one was from a Mozambican national. Tell us about that system in terms of tracking who is giving birth, who is at the hospital, that system, how does it operate?
We have a system now that we have installed. I'm very aggressive now on e-health. Pity you didn't come and see our command center of that. We are going to link it to all other hospitals, even to know who's coming to the hospital. So that system has been installed to all the hospitals. Now we know when you get it at the reception, when we register you, that which country are you coming from, where you were born. We've linked it with the Home Affairs again. So it's working absolutely well because that's why we are aware that now we have 12 mothers from South Africa and 1 mother from Mozambique. Same as in Tembisa, we had 2. It was 1 from Mozambique and 1 from Zimbabwe. So it helps us now because no one now can thumbsuck the figures of the people that comes to our hospital, because sometimes, remember, people were saying more children that are born are coming from outside countries. Yes, it can happen, but we will know which hospital that is having those numbers. In fact, the breakdown that I'm going to give you this afternoon that we're preparing for all the hospitals, we will know even the number of each hospital that we're coming from the other countries and those that are coming from South Africa. That detailed information, we have it in our system.
Yes. Now, MEC, back in 2020, 2022, there were some serious stats around, births, children who had died during birth, especially from this hospital. How have those numbers decreased, and how are you making it safer for mothers in this maternity ward, making it safer for mother and child?
The numbers have decreased drastically. I think it's because of the campaign that we have of I Serve with a Smile campaign. When a parent screams, I say everybody must run to that person because that person needs assistance. And I think our nurses are hands-on, and again we're beefing up the capacity so that at least they have more now nurses that are in the ward that are assisting the mothers. So it has decreased drastically, including the teenage pregnancy. We don't have any mother that is a teen here, which I'm excited about it. Same as in Tembisa, we didn't have any teen mother that gave birth on Christmas, which it was an excitement because again, immediately last year, after I've been crying everywhere about the children that are teens that are giving birth, we wrote to the Department of Justice. We became friends of the court with the department. Now here there is a form that we fill in once we find a child that is underage that is giving birth. That form we fill it immediately and we hand it over to the security cluster so that they can start doing investigations and take that person. Pity that we have not been talking about this and scream about it, but we started doing it in Gauteng, that everyone that is involved, that has raped the child or whatever happened, that child end up pregnant. We have investigations that we do and forward it to the social development, to the cluster units to deal with it immediately. So, and it's an excitement to me. But again, I have an aggressive campaign that sits in my office. It's led by me on teenage pregnancy because I have now a strategy that has been developed on teenage pregnancy. That's why you find me everywhere in the community, in the hostels, in the townships, corner to corner. I even have a program called Sizaku where I go to the communities and I block 4 corners of that area. I know all the wards now. We have a database of every ward in the province, which we have 539 wards, that each and every area in a corner want to know who is not well, who is pregnant in a family, who's got diabetes, hypertension, through that program. I think it's helping because now children knows now if they are, and again we have youth-friendly zones in our clinics. At 2 o'clock clinics are open. Children after school, they can go to the clinic and ask for assistance. But we have Implanon now that we just plug it here in your left arm. For 3 years, the child will not be pregnant. They will go to school. It's working. These are the results.
Mm-hmm. And MEC, just another one. I'm not sure if you know about a case about a woman who died at a Westbury Clinic. Do you know about this case, and is the department attending to it?
We are attending to it. I know about it. Even yesterday I spoke to the facilities manager and I had a session with the MMC for social development in the municipality because we work very closely with them about that issue of that mother. So the investigations are in place.
We'll leave it there. Thank you so much.
Thank you so much.
Thank you. Thank you. Katleho, you've heard it there from the MEC, just explaining the ways in which the Gauteng Health Department is trying to make life better for not just patients or mother and children, but also the staff at the various facilities. This includes upgrading infrastructure and just making sure that systems are in place to track who's in the province's hospitals and medical health facilities, in clinics, and just outlining there that they remain committed to seeing healthy births, not just today, but going forward into the future.
All right, Katleho Sekhotho bringing us that update from the Chris Hani Baragwanath Hospital in Soweto.